Megan Buggles is Senior Policy Analyst at the Center for American Progress for the Disability Justice Initiative. And Megan, it was fascinating. The story caught my eye about what would you thought would be a positive. Those victims of long COVID could potentially qualify for disability resources, for protections. But actually, when you shine a light on it, when you dig a little bit deeper, it could do more harm than good for actually those within the disabled community. Can you talk to us about what giving money and resources to those with COVID, long COVID, could do for your people that you fight for every day?
Absolutely. Thank you for giving me this opportunity. I would just like to start out with that we shouldn't pit folks in the disability community against those who are now developing long haul COVID symptoms. We just recently celebrated the historic passing of the ADA, which is the Americans with Disabilities Act. And while that has provided so much safety and security against discrimination for people with disabilities, we have a long way to go. And the pandemic has shown that. COVID-19 did not create these disparities that we are seeing. It has only highlighted those. And so when we move forward and when we're asking for support, the disability community has been asking for these for decades. And so we want to bring people together because we want to support those who were struggling before the pandemic and during the pandemic and prior. So moving forward, when we're talking about supports, that looks like direct services to the disability community and those now joining the disability community. Yeah. That is providing direct resources and finances into their pocket. That means modernizing and funding Social Security. That means updating the monthly benefits to give more people money in their pockets to uplift them from poverty. That also means providing education tools for those who are joining the community with long-haul COVID to provide them information on what services are available, their eligibility, and the programs that we have to serve them.
Megan, how many people are we talking about here? How many within the disability community do you serve as it stands?
Prior to COVID, 1 in 4 Americans had a disability. That's a quarter of our population. And we are seeing some of the largest growths in this community that we've had in decades due to COVID-19. Roughly 34 million people have been diagnosed with COVID-19. The research is still developing on how many people will develop long-haul COVID symptoms, but we're looking at potentially 1 in 3. So there are millions of people that are going to join this already diverse and wide population.
Talk to us a little bit about the history of health disparities here. You talk about the need to help within health, housing, social programs, education. How long have those areas been underserved? What have you been fighting for in the years leading up to what has now been the COVID disaster?
Absolutely. This pandemic has disproportionately harmed communities of color and the disability community. We see that with the numbers of those who have contracted and died from COVID. Congregate settings like nursing homes and jails have been some of the most dangerous places to live and work during this pandemic. And these disparities that we're seeing in the pandemic did not come out of the blue. They stem from a long history of discrimination in this country in our healthcare system, the lack of access, the mistrust. It stems from the social determinants of health, which the CDC has started to research and push more. That means your poverty, housing, segregation, all affect your health outcomes. And we have seen that in this country has harmed communities of color and people with disabilities. So that means we're trying to target these structural failures in housing, transportation, employment, and that will make more people healthy and build our economy to be more equitable in the future.
Talk to us about the structural failings within employment, within housing, because a lot of what you say immediately makes it feel that this is a federal issue, a local government issue, but I'm sure that this is a private sector issue as well in many ways. What is it that corporates, that private sector employers can be thinking about right now?
Absolutely. I just want to highlight that prior to the pandemic, people with disabilities have been hurting. They are twice as more likely to live in poverty. They have higher unemployment rates, and only about 5% of housing is accessible for those with disabilities. So yes, there's so many different things that the federal government and state governments can do to support those with disabilities and those who are developing disabilities. But corporations have a place as well. Our world is changing. Employees and customers want to work and buy from corporations that share their value. And like we said, a quarter of Americans have disabilities, and that's growing. That means corporations are employing and should be hiring people with disabilities. That also means their consumers and their customers are people with disabilities. So corporations have an obligation to create a more diverse and equitable workforce. That means providing reasonable accommodations. The administration has put out some guidance around reasonable accommodations specifically for long haul COVID. The Jobs Accommodation Networks is a fantastic resource for employees and employers around reasonable accommodations. But that also means employers can take a look at how they are supporting and uplifting their employees. Do they have paid family leave? Are they paying are they expanding minimum wage? Are they eliminating sub-minimum wage? When we uplift our most vulnerable, corporations and this country will uplift everyone.
Megan Buckles, such a joy to speak with you. Thank you so much for spending some time with us. Megan Buckles, Centre for American Progress. She's a senior policy analyst and at the Disability Justice Initiative. Thank you so much for your time.
Thank you so much for having me.